I'd like to talk to you about dental tourism. And there's nothing wrong with that, of course. You as a patient got every right to do whatever you want to go and have your teeth treated by anybody. It's not an issue. But the problem that I see in my practice is when people come to my practice, they have dental work done elsewhere and they want things rectified, or they think it was the right treatment, they want things rectified. There are good dentists in all parts of the world that are dedicated to good dentistry. The problem is sometimes dentistry takes time. And when you're in certain places for such a short time, where they take you from the airport, take you to the hospital and do your dentistry and then put you back in the plane, send you back home, there's just not enough time to do the following. First is diagnosis. It takes time to achieve diagnosis. Sometimes I have patients that I'm not quite sure what's the best diagnosis. It may take a few visits for me to establish what is the best treatment for these patients. In other words, you can't take the plane back and forth to Australia for me to achieve to prescribe the best possible diagnosis. Number two is the fact that I don't know you as a person, your history, your medical history, your dental history, and your social history. So there's a lot of issues here in life that makes you come in for dental treatment. I need to find out. So when I see the patients that come back with disastrous results, it makes me rethink, why would this person leave Australia and go to other parts of the world to have dentistry done? It must be a reason. Now again, there are very good dentists in all parts of the world that are trained in good institutions, good universities. And the important part is that those dentists, if the patient's seeing those dentists, I can assure you the fee will be very much similar. Because the dentist with the specialist qualifications who's trained in prestigious universities will probably most likely do a similar diagnosis, and the treatments wouldn't differ much, neither would the cost. It's a matter of not understanding that saying the cost is going to be less costly because I'm going to pay for this ticket. I'm going to spend days away from my work hours from work. I'm going to go to another place, pay for the hotel, and somehow the agent who sponsors me to go and have the dental treatment done is not going to make any money out of my treatment. The whole thing sounds absurd. It's absurd because the only person that really benefits from your treatment is the agent who has taken you to that place, people who pay for your airfare, which is you, and airplanes, and the hotels who make the money. I can show you the dentist at the end of the day is actually making very little money from you because you actually end up there by another person who's actually made contact with the dentist to take you there. The other important thing is that there's a minimum amount of time where you're in that country that treatment is being done. And I won't mention anything about the technical support, the laboratory support, the dentist qualifications, their expertise. And the trouble I find in many ways, and dentists will say, the patients tell me, oh, this dentist is highly qualified. When I Google their qualifications, it's absolutely minimal qualifications. And their postgraduate qualifications are usually zero. So I can show you that that's my experience when I see my patients in my practice who present with complex failure of the recent dental work, which could be within 2 weeks to 5 years, things fail. The quicker the fail, the better it is, because I get a chance to fix it. So this lovely patient presented my practice having dentistry done overseas, and she had a protruding teeth, a teeth of sticking out forward. So what the dentist did, he cut his teeth down and he devitalized the teeth down, made them all unnecessary root canal therapy so he can angle the teeth in, and he made these dodgy crowns. When I say dodgy crowns, they are dodgy. The patient presented my surgery saying my gums are bleeding and my mouth stinks. I can't even kiss my boyfriend and let alone have a relationship. So this beautiful girl has been turned into a catastrophe. So this dentist unnecessarily, I cannot imagine how could someone go in and cut someone's teeth unnecessarily and basically predispose and commit this patient to a lifelong treatment, an expensive treatment, to be able to improve this patient's aesthetics when a simple treatment measures could have done perfect result. So I'm faced with a disaster to start with. The problem that I can see here is that patient presenting with this situation is looking for a hope. She wants an answer. The answer is not so clear. Do you know why it's not clear? Because I don't know what I'm going to find when I remove those crowns, those dodgy crowns that was placed in the first place. I don't know what I'm going to find underneath those crowns. Okay? And thank God in this particular patient, and this lovely patient, I was able to find some teeth that I could anchor on. We had to replace all the 6 teeth that required root canal therapy. Replace those root canal therapies. They were terrible dentistry. I couldn't find them, dentists to call them and ask them, why did you do this for the patient? Okay? And I find them and I find this dentist and ask them, why did you do this? And the patient wanted to do so. So I don't understand. As a profession, if a patient wants you to do something, you know it's biologically incorrect, do you actually do it? What sort of conscience do you have as a dental professional to actually destroy this patient's biology? In Australia, we have laws and regulations. We prosecute those people. But overseas, unfortunately, there's no recourse. You are basically on your own. It took over 2 years to treat this patient. We had to do gum surgery, bone surgery, root therapy, temporary crowns, okay? Assess the whole healing, lots of pain, lots of discomfort. Thank God this patient was able to go through the whole procedure. Of course, we got a good outcome. That's because of my specialty, my expertise. Let alone if she went to another one overseas, what would happen? She'd have no teeth left in the mouth. I still can't guarantee her anything because they've destroyed the teeth, the foundation for the crowns. It's all destroyed. Patient has to be so careful for the rest of her life not to lose those front teeth. So the answer to the question, oh, well, doctor, I only went overseas because it's cheaper. Cheaper? Is it cheaper because of the cost of a biology loss? Does it really cost you cheaper because I had to redo the whole work? And this work will require redoing every probably 10 years? You could buy a house with that. So how cheap is it? I'll leave that answer to your discretion and to the overseas dentist consciousness. Because when you come and see me, at least come and see me before you travel overseas for dentistry. Because the solutions that can be provided as a specialist could be a lot simpler than the average dentist provides you overseas, which is far more complex, destructive, invasive, because the name of the game is monetary gain by the dentist, by the agent who takes you there, by the hospital, okay, and all the other auxiliary people who really don't give a stuff about you or about your health, and all they need is your money. I think about your health, your well-being, and the most important, preservation of your biology, and to improve aesthetics if you can. Please reconsider, and I'm most happy to help you to make that final decision for your dental needs.